Hi, this is Dr. Mahadevan, and we're going to continue with Basic Life Support and Airway Management, Part 3. And as we mentioned before, in going through our BLS algorithm, if the patient is unresponsive, we're going to check for a pulse, and then depending on whether the pulse is present or absent, that will determine whether we give just ventilations, if the pulse is present, or both compressions and ventilations, if the patient does not have a pulse. Providing ventilations is very important, and we're going to discuss that now. When you're providing ventilation, there are 3 steps. The first step is going to be to open the airway. The next step is going to be to insert an airway adjunct. And then finally, once you've done those 2 things, we can provide the patient with rescue breathing. So let's talk about the ways we can open the airway. What's depicted here is the head tilt chin lift maneuver, and basically by tilting the head back and lifting the chin, what we do is pull the tongue forward, and in pulling the tongue forward we relieve this airway obstruction so that air can make its way through the patient's mouth and nose and into the trachea and down to the lungs. The head tilt chin lift maneuver. An alternative maneuver to the head tilt chin lift is the jaw thrust maneuver, where we grasp the angle of the mandible on both sides and pull the jaw forward, essentially achieving the same thing, which is pulling the tongue forward and relieving the obstruction of the airway from the tongue. When we're talking about the head tilt chin lift maneuver, we have to keep in mind that sometimes it's potentially hazardous for the patients. Take the example of this patient who has a fracture of the vertebral body of C2 and significant soft tissue swelling anterior to that vertebral body. So clearly has a cervical spine injury. Well, in this patient who has both of these injuries, the soft tissue swelling and this fracture, you can see before we do anything that the cervical spine is nicely aligned. It's straight. There is no movement of the bones, and the spinal cord sits right back here and is doing just fine. However, if we were to employ the head tilt chin lift maneuver and extend the neck, what you see happens is that because there is disruption of the ligament, that the bones actually move posteriorly, and again, the spinal cord lives back here, so potentially with a ligamentous injury such as this patient has, and employing the head tilt chin lift maneuver, we could potentially harm the patient. So in cases like this, we don't want to use the head tilt chin lift maneuver. We want to use the jaw thrust maneuver. Here's a patient whose eyes are barely open and who's definitely having a difficult time breathing. As you can hear, you can actually hear her breathing. She's moving her head from side to side. She's not paying attention to her environment. So this is a patient whose airway we need to open. Clearly her tongue has fallen back, and that's why we're hearing this noisy breathing, and we need to open her airway. So how can we do this? Let's employ the jaw thrust maneuver and see what happens. So now we've employed the jaw thrust maneuver, and again we're pulling the angle of her mandible forward, and what you can see now is she's no longer making any noise, and you can actually see fogging in the mask, suggesting that now air is making its way from her lungs, out of her mouth, and into the mask. So the jaw thrust maneuver has opened her airway. It was closed before, obstructed. The jaw thrust maneuver has now opened her airway. Step 2 in providing ventilations after opening the airway is to insert an airway adjunct. And the one that I've shown here is the oropharyngeal airway, which is inserted into the mouth and again allows air to be directed through its hollow chamber towards the glottis and the trachea. And the other device that we use is the nasopharyngeal airway, which is inserted into the nose and then again does the same thing, allows air to be directed towards the glottis and into the trachea. Oropharyngeal airway in through the mouth, nasopharyngeal airway is inserted through the nose. The oropharyngeal airway is a curved, rigid plastic device, again with a hollow central chamber that allows air to make its way towards the patient's glottis and trachea, and also has a secondary benefit of pulling the tongue off the posterior pharyngeal wall and keeping that airway open. And best of all, once it's inserted, we don't have to keep trying to hold the airway open with our hands. The NPA is a soft, flexible rubber tube that is inserted through the nares, and again, it also allows air to be directed towards the glottis, the patient's trachea, and ultimately into their lungs. And so, first we open the airway, then we insert these airway adjuncts, and finally, we're going to assist ventilation with a bag mask device that's attached to oxygen. If we only have one provider, we're going to use one hand to squeeze the bag and the other hand, as depicted, to hold this mask onto the patient's face. And typically we use the E-C maneuver to keep that mask tightly adherent to the patient's face. So the E-C maneuver with our 5 fingers if you only have one rescuer. If you have 2 rescuers, one rescuer is going to squeeze the bag and the other rescuer is going to use both hands to hold that mask onto the patient's face to allow the maximum amount of air to enter into their mouth and towards their glottis and trachea. And it also allows them not only to hold the mask on their face, but also open the airway. So extend the neck if it's permissible and keep that airway open. So remember, when you're providing ventilation, there are 3 steps. Open the airway, insert an airway adjunct, and then provide rescue breathing. So in basic life support and airway management, remember that ventilation plays a very important part of taking care of these patients, regardless of whether they have a pulse or not. And the steps are going to be: step 1, open the airway. Step 2 is to insert an airway adjunct. And step 3 is going to be to provide ventilation with a bag mask device. Thank you so much for your attention.